all to the Cohen Community Center, one of 7 community centers of Spectrum Generations. And it is my true pleasure to introduce a true aging advocate, Mr. Richtman. He's currently President and CEO of the National Committee to Preserve Social Security and Medicare, and that is one of the nation's most influential senior advocacy and education membership organizations. Please join me in welcoming Max Richtman.
Today is a day of action for a lot of senior groups, including the National Committee to Preserve Social Security and Medicare. We have started delivering petitions from our members to the Congress. And those petitions say, don't cut Social Security, don't cut Medicare, don't cut Medicaid. It is true that we have a serious debt, $16 trillion. Guess how much of that Social Security is responsible for? That's right, zero. Zero. Social Security has a surplus. Social Security has a reserve of $2.7 trillion that has been set aside so that people like me, baby boomers who start retiring, will have the resources from Social Security. Social Security has not contributed a penny to the federal debt or the deficit each year. Last year, because of high unemployment, less money came in payroll taxes than was needed to pay out full benefits. But everybody got all their benefits because this trust fund of $2.7 trillion, that money is invested in treasury bills. That money pays interest. So even though less money was paid in FICA tax, the interest that was paid to the Social Security program not only paid was allowed the program to pay all the benefits, but actually added money to the trust fund. Now the other effort in Washington is raise the age, right? Let's raise the age for Social Security. Let's raise the age for Medicare. Gradually, retirement age will be 67. Now, there are folks in policymakers, advisors who feel that the Social Security age and Medicare age should go up to 70. To go up to age 70 for Social Security and to keep working assumes, first of all, there's a job, right? Where are all these jobs of people 67, 68, 69? How many people do you know that are able to acquire gainful unemployment at that age? It's not that easy.
Let me talk to you a bit about the federal budget and about Social Security and Medicare. The first thing I want to say totally, clearly, and unequivocally, no privatization of Social Security and no voucherization of Medicare. Now, as many of you know, we have a budget problem in Washington. And it's pretty straightforward. We're spending more than we take in. And we've been doing that since about the year 2000. And it's a nonpartisan problem. Some people will lead you to believe that it's all Barack Obama's fault. Others will say it's all George Bush's fault. The truth is, it's a bipartisan problem. It started in the early part of this century when we cut taxes but didn't cut expenditures during the George Bush administration, when we had 2 wars that essentially weren't paid for. And then we've had substantial expenditures during the administration of President Obama that exceeded income. And the problem is it's a deficit. I mean, if you make $25,000 a year and you spend $35,000 a year, eventually you're going to be in trouble. And that's essentially what the federal government's been doing for the last 10 or 12 years. So something has to be done about it. And there are all kinds of proposals on the table. But I ran across about a month ago 3 graphs, with lines that really said a lot of what you need to know about the problem of the federal budget. One of the graphs was all the spending of the federal agencies other than defense and Social Security and Medicare. In other words, what we think of as the federal government, national parks, air traffic controllers, highways, all of those kind of sort of routine expenditures. And they were projected out at current levels for the next 10 or 15 years, and they were pretty flat. They were pretty level in terms of how much of the economy they took up. Then there were defense expenditures, which is a big part of our budget because we're the only superpower, and they were pretty flat. You know where the upward trend was? Everything involving health care. It's healthcare expenditures that are killing us. Not Medicare per se, not Medicaid, but just healthcare in general. And so to me the answer is don't say that seniors have to pay more for their Medicare or pay a larger share or something like that. We need to do something about the underlying cost of healthcare for everybody, whether you're a senior or whether you're 35 years old. And the Affordable Care Act, the Obama Health Care Act, starts that, but there's a lot of work to do to start paying for health care in a different way. And there's some experiments going on here in Maine, one right here in central Maine, where we're going to pay the medical community, the hospitals and the doctors, for keeping us well instead of treating us when we're sick. I'm just delighted to be here. I don't know whether you have time for questions.